Hi, I'm Dr. Mahnaz Rashti. I am a periodontist practicing in Beverly Hills, California. So a lot of patients call me when we are like on long weekends or vacations or holidays and complaining about toothache, and they want to get something that will relieve their pain while they're home and waiting for Monday morning or after holidays to come back to the office. So, and I'm sure that if you go online, you see many different remedies. They're talking about garlics or peppermint or cloves or guava leaves. There are many different home remedies that they recommend. Generally, if you have a toothache, there's two different issues. One is if you have a very large cavity which ended up being into the nerve of the tooth, and that pain is severe, and it's so bad that you cannot even do anything about it. So when the toothache is related to the root canal problem, I promise you none of this is going to work. It may give you very limited amount of comfort, but that throbbing and sharp pain because of like root canal is not going to be dissolved until you go and see an endodontist and they get access to the nerve of the root and remove it for you. You may get temporarily comfort by applying ice, and that's only for certain people. I mean, some people you apply ice and they're going to be in severe pain. Some people report that if you put ice on it, they get some comfort. You may also use some medications, some antibiotic or so anti-inflammatory medications, but at the end of the day you need to see your endodontist and do the root canal. If the nature of the pain is some abscess, you can definitely start to rinse with warm water and salt, and make sure you don't put too much of salt because you actually burn your gum. So there's always a cup of water with a very little pinch of salt that it will take the inflammation out of the gum and gives you some relief. What I also recommend to some of my patients when they say that they notice there's an abscess is that I want you to start to floss, but be a little more aggressive when you're flossing. So you go with the floss below the gum and go a little more and try to create a very small cut. Through that little very small cut, what you're going to see is that you get a lot of pus or pressure drains through that cut and gives you time to come to the office the next day or see your dentist the next day. You also want to make sure that you ask for your dentist to give you some antibiotic and pain medication until it's time for you to go and see your dentist. Please make sure you comment down below. If you have any question, write your comment. I'll be more than happy to answer to them. Subscribe to our YouTube channel and make sure you brush and floss.